Not all outcomes are good. Recognize what's normal and what's not. Stephanie here with Healthcare-Edu. Check me out at nursestephanievictoria.com. I'm here to help you pass the MAP test, okay? Medication Administration Program. So what I want to talk about in this video are the outcomes that can be achieved when you administer medication. And it's important to understand the categories so you know how to proceed from there. Okay. So you can have a desired effect. So say I have a headache and I take a Tylenol for the headache. Usually a pill, 30 to 45 minutes, my headache is relieved. So the desired effect has taken place. I took the Tylenol for headache and it has indeed helped my headache. Okay, so desired effect. Then you have no effect. No effect means that I had a headache, I took Tylenol, I still have my headache. I don't feel sick, it didn't give me any side effects or anything negative. It's almost like a null. It's almost as though I just drank water. I did nothing at all. It did not have the desired, it had no effect. So you have desired effect, the Tylenol helped my headache. You have no effect, the Tylenol didn't do anything. I still have my headache. It did not relieve my headache. You have side effect. I take a Tylenol for a headache and it could help my headache, maybe not, but also it's made me nauseous. Now, the side effect has categories. Although being nauseous is not pleasant, but it's certainly not, emergency, call 911, right? So that's a side effect. It's milder. It's something that you did not intend to happen, but the patient is experiencing. Okay, so let's review. We've covered desired effect, no effect, side effect. Then we have adverse effect. Adverse effect is a side effect, but more severe than nausea. And it falls into 4 categories. So adverse effect is that this medication has caused something to go wrong with the patient. The patient's not handling it well. The patient's having negative experiences, but it is more drastic than just nausea. It's more drastic than a side effect. And this adverse effect is in 4 categories. The categories are allergic reaction, anaphylactic reaction, paradoxical reaction, and toxicity. All right, so let me say that again. The adverse effects fall into 4 categories: allergic reaction, anaphylactic reaction, paradoxical reaction, and toxicity. So let's go over them one at a time. Allergic reaction, you're not like in school to be a nurse practitioner. Basically, you've taken a medication and your body views it as foreign and is basically mounting a defense against it. Symptoms could be vary. Some people get runny nose, they cough, they get itchiness, hives, all of that over an allergic reaction. Anaphylactic reaction, remember in healthcare, it's airway, breathing, circulation. So anaphylactic, immediately somebody do the choking sign, their throat is swelling up. This is certainly a 911 scenario. There's some people, but I would imagine if they were allergic, you wouldn't have given it to them. There's some people we know that they have certain issues and we train the staff to use an EpiPen. So if you had an EpiPen on board, you could do that. Paradoxical essentially is the opposite effect. So if I take a sleeping medication, Ambien, right? Because I just have a hard time sleeping. And instead I'm up all night. And so those medications to help you sleep are sometimes anxiety. Be careful because they are sometimes prone to have a paradoxical effect, meaning the opposite happens. So instead of sleeping, I am now up for 14 hours. I can't sleep at all, okay? And toxicity is when the level of the drug is too high. So not to delve too much into pharmacology, when you take a drug, it's not like you take Tylenol and it lasts your entire life, right? It clears your system. You absorb it, it's distributed, and metabolize it and excrete it. So it has an amount of time for it to be in your body. Now, a lot of people with kidney issues, renal issues, maybe, or some other issues, okay? There's a lot of reason why the levels of the medication keep building up. So this is called toxicity. And so a lot of times, maybe some psych meds like lithium might do that. And again, I'm just giving you 1 or 2 examples here. Obviously, there's tons of medication that can affect all of these categories, but giving you examples of what I see commonly. So again, Desired effect is when the medication does what it's supposed to do, what you expect it to do. No effect is that you took the medication and it did not relieve the symptoms, but it also did not cause anything negative. It just had no effect. Side effect is a negative occurrence, but more of a milder manner, like maybe nausea, maybe upset stomach. So it's unintended. You didn't want that to happen, but it did. So adverse effect is a more extreme version of a side effect. Under adverse effect, you have 4 categories, and those categories are allergic reaction, anaphylactic reaction, paradoxical reaction, and toxicity. Allergic reaction, you might break out in hives. Your body mounts a defense against it. Anaphylactic reaction, your throat is swelling up, to put it in simple terms. Paradoxal, the opposite occurs, meaning you take a sleeping pill, but instead you're awake. In toxicity, the levels of the med keep climbing in your system and they become too high. All right, I hope you found this helpful. Thank you. Bye.